Ooh. All right, ladies and gentlemen, it's time to wake up. I have our Congresswoman, Brenda Lawrence of the 14th Congressional District. That's her up in the upper right-hand corner. And in the middle, I have Jacqueline, what's your last name? Patterson, right? Jacqueline? Well, Jacqueline's here anyway. She's going to steer you. Congresswoman, I see you have to bring security on with me. I don't bite. Come on now. Come on. I just want you to know things are lovely here in the 14th district, and I'm not looking forward to what happens Sunday. It's going to be 70 degrees and sunny in Detroit, and that'll be a real test of your cousins and mine. But Congresswoman, let's go back to what you're doing. Congresswoman, let's go back to what you're doing in Washington. First of all, we've had a lot of complaints from a lot of small businesses that they could not access the PPP. Your staff, I know, has been working on it. That's inside baseball to me. But can you tell us what your staff has been doing to increase the access for all small businesses, not just Black, not just white, all of them to PPP?
So first of all, I want everyone to know that I hear you. I have been talking to so many of you. I care about your health and safety. Please stay safe, stay at home. I flew in last Thursday to increase the amount of money. Stephen, as you know, in the business community, our first CARES Act, which was the right thing to do, we provided unemployment payment. We increased the unemployment by $300. We did a one-time payment to every working person in America. If you file the income tax return, you receive the stimulus money if you were in a certain income bracket. We took care of our hospitals. We took care of our business community by providing over $1 trillion worth of loans. We looked at also what we're doing to provide the insurance for people to take leave as well due to the virus. But what happened was we ran out of money. We ran out of money in a matter of 4 days. The overwhelming need for support was amazing to all of us. So we went back to Congress last week, and I want you to know that was a very interesting journey, going through an airport that was almost empty, so I didn't have to worry about distancing. And it almost felt like I was on a private jet because no one else was on the plane.
You fly into Dulles, Reagan, or
International, into
okay.
Reagan.
Okay, to Reagan National.
And then to go on the floor where we change procedures, where you'll see us all on the floor at one time. We were divided into groups, and your group was called. You will walk over to the Capitol. You walk in, vote, and leave, and go back to your office until the next vote. So with that being said, we ran out of money after the first one. So we came back last week and we voted to increase the amount of money that we were giving to our small businesses. But we did something extra. Because what we heard with that first group, like Ruth Chris, Shake Shack, basketball teams were getting this money. And that was not the intent. It was for your small businesses to hold them over, not these publicly traded companies that had all these resources. And so we deliberately gave $30 billion to the small and medium-sized banks. So the intent of that was that most small businesses will do business in the community that their business is in. They go there, they bank with them. And so we opened it up so credit unions and small banks will be able to process the loans where they weren't before. So with that being said, our intent was that we would allow these small businesses to have more access. Because my big banks, I just got off the phone with Bank of America. Our big banks had so many applications. I am told that Bank of America had over 400,000, and we did go back and allow them to batch them together to expedite it. But first of all, SBA was not prepared. Their portal crashed. I was so frustrated because I'm calling my businesses. Okay, tomorrow they're opening up opening up for loans again. I was on the phone with people. Okay, 1 hour, everybody better be ready because they're going to open the door. You got to get in there early. And then it crashed. Right now, when I get off of the phone with you, I'm going to go and talk to the SBA to find out what's going on. But that's what we've been doing in Congress to really try to give people just a bridge so that they can get over this troubled water and to be able to sustain themselves until we open the doors back up.
Okay, that's the first issue. I mean, because a lot of small businesses are hurting. There are a lot that aren't going to come back, aren't going to make it back after this. Well, let's talk about the human cost. The city of Detroit, which is part of the 14th Congressional District, is
Yes.
doing a wonderful job testing. Mayor Duggan has now opened it up to all essential workers and grocery store workers. What is going on in Oakland County, the other part of the mighty 14th Congressional District?
So one of the things we found out is that the coronavirus, COVID-19, disproportionately attack African Americans, and the death rate is higher. And that's been very troubling to me and so many people. And so I have been on a mission to increase testing in our community where there's Black Americans living. We know because we've mapped this virus, where is it hitting, the zip code. So we have a map of zip codes that we call the hardest hit. We know 48235. We know that 48075 is one of the hardest hit. And if you look at proportion to population, it's harder hit than some of Detroit hotspots.
Really?
And so I went to Oakland County Executive and I said, you're testing in Pontiac where 48075 is in Oakland County. It's one of the hardest hits. Why aren't you here? And he had designated Rudy Hobbs to be his point person on this. I got on the phone with Rudy and with the county executive, and I'm proud to say we're going to start testing in Southfield next week. It is extremely important if we really want to stop the spread of this virus, that we test those places where we know it is a large volume of people who have the virus and have seen death. It's this task force that the governor has started. I'm serving on the testing part of that. And we've got a lot of work to do because I can't tell you how many of the people who I'm calling to give my condolences because their loved one has died, who said they went to the emergency room 4 times and they sent them home. And finally, when they went in and they can't breathe and whatever, then they took them in and put them on a ventilator. Well, only 88% of people who are put on a ventilator live. Few people know that. And so why are African Americans being told to just go home and just sleep it off, quarantine? When you know that African Americans are dying disproportionately at a higher rate, we should all be on the same. When you triage an African American, it should be certain criteria. If you have diabetes, if you have heart disease, if you have high blood pressure, then you should be triaged at a higher level because we know that this virus attacks people who have those underlying conditions. And this is something that I really want to say, Steve. Some people want to say, well, Black people should take better care of themselves. They're the ones with all these diseases. It's so many reasons. And we in the Black Caucus talk about this a lot, is that the history of healthcare in the African American community is not a stellar one. We have a sitting member of Congress, Jim Clyburn, who told us that he, as a little boy, remember going to the doctor's office, having to go around to the back door with a sign that said colored only. Now, just think about the disproportionate impact of that. And so many African Americans growing up with a lack of trust. We all, I still heard stories from my elders about the tests that they did, the clinical trial with syphilis, and how many of the African American men were infected. And there's this lack of trust. You talk about food deserts, the ability to buy healthy food and have access to healthy food. The historic uh, gene of passing things on. You know, my generation in the family said, you know, we tell the next generation, get ready because you're going to have high blood pressure. It's just something our elders have given us. But we have to, and if I can take just one more second, every time I would ask a medical professional, why are we dying more than other races? Hispanic is second. Asian Pacific is also in there. But why are we dying more? And they said, because you're sick. We know, Black people have more diseases, pre-existing conditions. That's unacceptable. It's like, yeah, that's just the wind is blowing. Yeah, so you all are sick. So you're going to die. So we have directed, and the Black Caucus stepped up and fought this through, that in this next bill that we're going to be doing in a week or so, CARES 2, we're calling it, is that we direct CDC to collect data by race. This is something that was optional. It was not done. We really don't have a clear picture. But even with the hodgepodge of collecting data, we're still at 38% dying, and we're only 13% of the population in Michigan. In addition to that, they have to collect the data by race. They need to make a public report to America. What are the conditions? What is happening with the status of African Americans? And then the third thing that's so important to me, develop a plan to reduce those numbers, to reduce that disparity. What do we need to do? Do we need to have an incentive to place food markets and food deserts? Do we need to do an enterprise of mobile grocery vegetable carts to go into those areas? What do we need to do? Do we need to have access, our community health centers? This administration is constantly attacking them. We need to stop that and fund those things.
Okay, let me go into another area that goes along with what you mentioned in terms of food deserts. What are your thoughts on the president trying to open up the food processors again? Because we have many food processors here in Detroit that are operating and eventually could get affected. What are your thoughts about that and the possibility of a beef shortage and dairy shortage?
Well, the beef shortage won't hurt anyone. If we don't eat any red meat, I'm just a believer that we'll be okay.
Speak for yourself. I'm a carnivore.
I know. However, before we open up any business, we have to be very deliberate and very pragmatic to ensure that we test. There have been outbreaks in these processing plants of the virus. You can't just say keep them open, keep people working. You have to test them, make sure that the environment is revisit the physical environment to ensure safety within the workplace. And so it's easy to stand behind a podium and say, just reopen it. What do we need to do to make sure that we're safe? Secondly, I have a hard time understanding why people are standing in mile-long lines across this country to get food, and we're allowing farmers to just let the food rot on the field. There's something, it seems like it's a deliberate attempt to keep food from Americans. I don't understand that. So that's where we should be putting our energy. How do we take that food that these farmers have grown, pay them for it, and take it to places that we need food? Before we open up, and this is why these people who are protesting, saying, you're taking away my liberty. No, we're trying to keep you alive. We have not stopped seeing 130 something people died yesterday. This is real. And for me being the Congresswoman in the 14th district, having a large African American population, I will tell you, I am so sensitive to the death piece. I have grieved so many people that I know who I talked to before I got shut down, and then now they're gone. It's over. They're dead. And we need to protect lives, all lives. And I am not in any hurry. I know that my small businesses need to open. We need to gradually start reopening things like landscaping. A landscaper doesn't come in contact with other people. Can they do their work? When we're talking about the construction trades, but we have to ensure that we're doing it, and we shouldn't be doing it just to keep the economy down, but our numbers, the infection rate and the death rate should determine who and when we open up for small businesses.
Okay, final question, ma'am. Just like the African American population is being hardest hit with this, so are the historically Black colleges and universities. Is there any possibility in CARES Act 3 that there'll be some sort of carve out for the HBCUs to help keep them alive?
We have not had that direct discussion. I can tell you what the priorities are right now. Testing and those hot spots, prison populations, nursing populations, because the universities were allowed to close down to stop the spread that would be on the campus. But we're looking at funding for universities because, you know, Michigan State, my granddaughter goes there, and they have refunded some of the money. It has to be applied to next year, but that's okay. At least it was a refund. And so we're aware that there's some challenges, and the historically Black colleges in the Black caucus is always a high priority.
Okay. Anything else you want to say to your district, ma'am?
Yes, I want to say to everyone that this has been probably one of the most challenging time in my history. You know, I was a child when the Vietnam War was going on, and it was very challenging. However, as an adult, 9/11 didn't happen here in Michigan. You know, my heart grieved for that. But this is so personal. And I want everyone to know that for whatever reason this is happening, and I can't define it, that it takes all of us together. And I want everyone to know that I will do everything in my power to work to ensure the safety of the 14th district. Michigan has been a model on how you can lower the curve to bring the cases down, and our governor has stepped up, and she's getting a lot of calls on what did you do. Oh my goodness, the mayor of New York has just been tremendous. He has really walked us through what this epidemic looks like. And we will get back together again. And that day would be one that I welcome a lot. But please wear your mask if you go out, wear your gloves, stay at home whenever you can. And we need to look at our healthcare system and how we as a people are being treated. And our small businesses, please, please support them. When the doors are open, I know we're all holding on to our money right now, but when as you're able, please support our small businesses. Nordstrom is having its challenges, but I need the Avenue of Fashion to stay open. I need us to just come out. And the last thing I want to say is that I feel strongly that we need to have a national day of mourning. The end of the Vietnam War, we heard so clearly from those veterans coming back that we never recognized the deaths and the sacrifices that they made. When 9/11 happened, this whole country had a day of mourning and recognition. This has impacted our entire country, and we as a people need to have a national day of remembrance, mourning, and I'm going to make that recommendation to Congress.
Okay. Ma'am, I want to thank you very much for joining us today, and let's do it again soon. If you need to talk to us, give us a call.
Okay, you